World Health Day is celebrated on the 7th of April with the aim to raise awareness towards global well-being. This year's theme is My Health, My Right, which emphasizes the right to access quality healthcare, education, as well as information. To discuss this fundamental right in the South African context, I am joined by Professor Renata Schoeman, who's the Head of Healthcare Leadership at Stellenbosch Business School. Prof, a pleasure to have you on the program this afternoon. Let's start by discussing the importance of viewing health as a personal and social value rather than solely as a right. How can this shift in perspective empower individuals to really take greater responsibility for their own health?
Nkandla, it is so important. We confuse the right to health care with the right to health. Health is really a personal responsibility as well. There's genetics at play, but also lifestyle factors. And even having access to good quality health care cannot guarantee you health. Health care is actually focused on sick care. Once you're sick, you access the system. But we need to focus more and empower individuals to take personal responsibility in promoting health and preventing sickness or disease.
Let's look into the rising prevalence of non-communicable diseases like diabetes in South Africa. In your opinion, what role do social determinants of health such as lifestyle choices play in really addressing and mitigating these health challenges?
It's very important. Now, although the rising incidence of non-communicable diseases is also a reflection of the population that's living longer and getting older, which is good. There's also the access and improvement in access to more westernized food types. The problem is that is often unhealthy with a lot of sugar, a lot of junk food, etc. Now, when we look at a systemic perspective, where we look at the social determinants of health, we have to address unemployment and poverty to be able to have access to good quality food and healthy, nutritious food. We also need to look at education to really teach children from a young age what is their role in maintaining their health through exercise, diet, and avoiding substances of abuse and excessive screen time in a sedentary lifestyle.
Professor Schoeman, you've mentioned that universal free healthcare alone is really not sufficient for achieving a healthy society. Can you elaborate on the additional interventions or strategies that you believe are needed to really promote healthier lifestyle choices, but also prevent diseases effectively?
Yeah, universal health care is also not sustainable, and as we mentioned, it cannot guarantee health. We can look at various roles from the governmental perspective, but also from the corporate perspective, and also public-private partnership. One example that the private sector is doing very well is incentives for healthy lifestyle choices such as exercise and nutritious food, which is something that we should see how we can roll that out and make it accessible to people in the public sector. From the government side, sin tax is a very, very good disincentive where people, where the sin taxes on alcohol and sugary food, etc., are high to disincentivize people from consuming it. But we also need to get corporates on board. Yeah. Simple examples where vending machines can be replaced with access to healthy food stuff, for example.
Let's discuss the concept of primary, secondary, and tertiary prevention in healthcare. From your perspective, what specific initiatives or even policies can be implemented at each level to really improve health outcomes in the country?
So primary prevention means we promote health. That is where we really need to educate people, but also provide facilities for healthy lifestyle, like safe environments to exercise in, to run in, or gyms, and also the access to food stuff. Secondary prevention is about early screening and early detection of disease. That's where we really need to educate people and the importance of regular blood pressure checks, glucose checks, prostate checks, or breast cancer examinations, pap smears to prevent and identify disease early. And then tertiary prevention is where we need to really have access to sick care for early and effective treatment of disease to prevent complications. And a huge part of that is also education in terms of compliance with treatment.
So in your view, how can the healthcare system in the country then strike quite a balance between providing access to quality healthcare, but also promoting individual accountability for health?
Education is the first step. I think we really need to decentralize some services again, to have community clinics and even mobile clinics in more rural areas available. Secondly, the government need to make sure that there is incentives for healthcare professionals to work in rural areas where it is under-resourced at the moment, to promote accessibility. And then, yes, universal health coverage is an important stepping stone, but it only focus on the funding of such a service and not in optimizing the current services and resources that's available, and also educating the public in responsible use of the facilities and the care, but that we really empower individuals and enable them to have a more healthy lifestyle.
Let's speak about addressing poverty, unemployment, and also creating healthy living environments for improving overall healthcare. How can policymakers then effectively integrate these, call it social determinants of health, into healthcare policies and initiatives?
Ganda, the one thing for me is a policy is just a piece of paper. It's about how do we implement things and how do we empower the users of these policies to really have more effect. I think it's the wrong way of approaching this if we look only at reforming healthcare. We need to really take hand and really reform also the education system, where we start with preschool education and early childhood development to prevent even early problems in childhood. But then also we need to have a multi-stakeholder perspective and see how, when we address poverty, for example, we address also sanitation and waterborne diseases that we can prevent. The energy crisis can also then affect our water security and the health of the population. So we really need a multi-stakeholder perspective and not only focus on the Department of Health, what they need to do.
Professor Schoeman, you advocate for a comprehensive approach to health promotion, also encompassing physical and mental well-being as well. How can individuals or communities and even institutions work together to really prioritize mental health as part of this holistic approach to healthcare?
What is really a good thing that has happened during the COVID pandemic, if there's anything that's good, it was the increased focus and awareness amongst corporate about the importance of corporate mental health and keeping your employees healthy. So once again, it's about awareness. A lot of people aren't even aware that they struggle with a mental health disorder. And secondly, the media is so important in also helping us to eradicate the stigma associated with mental health so that people can access services early and get the necessary treatment. What is also very important is to know that there's the interaction. If your mental health is not optimal, it has a poor prognostic influence on medical disorders such as diabetes, cancers, etc., and the other way around. So to really raise awareness and to educate people, to eradicate the stigma, but also when you're in an organization, to help people to access care early. And that would mean accommodations, for example, to be able to go for therapy one afternoon a week or every second week. Or when there's really collaboration with occupational therapists to help people with reintegration at work, and according to the Employment Equity Act, to allow reasonable accommodations where appropriate.
Let's discuss lifestyle recommendations for maintaining good health. I mean, this at top of mind includes exercise, healthy eating, as well as getting adequate sleep. So how can we encourage widespread adoption of these practices within communities, especially among vulnerable populations?
I think firstly to provide the services or the facilities to enable people. Some communities, especially in the Western Cape, for example, cross-country in the winter is a big community affair, and it's an ideal opportunity to educate people there as well. But having safe facilities is really the first step. But then also to explain to people that even if you have an active job, even if you walk far to work, having exercise also have a mental benefit. We know that if you exercise deliberately 30 minutes 5 times a week, it can reduce anxiety and depression with 47%, never mind all the physical benefits that it has. So to really encourage that and also explain what is the role on the brain, what is the role on your, or the effect on your body in terms of how it can help with obesity, hypertension, sugar control, etc.
And lastly, Prof, as we observe World Health Day on the 7th of April, what actions do you believe are most critical for policymakers, healthcare professionals, and even individuals to really take in advancing the right to health and promoting wellness for all?
So firstly, I think from the public sector or the governmental perspective is to put their money where their word is. Not only to promise refunding of a system, but rather to focus at removing inefficiencies in the system that there currently is and to make it more economic and accessible. The secondly is really the collaboration between the private and the public sector instead of destroying the private sector, but to look at how we can collaborate, how can we provide better services, and their NGOs is very, very important and often at the roots in the community in where NGOs deliver services. And then lastly, from employers' side, is to really think and rethink how you can make resources available at the organization. But then ultimately, it's the individual's responsibility to be accountable for their health, to make healthy choices, and to focus on health promotion and prevention of sickness, rather than to become a sick consumer of a care system that's already taking a lot of strain.
Well, Prof, let me thank you for your time and thank you for joining us today.